Good morning. My name is Celestine Wanger. I'm your invigilator for the OET speaking test, conducting on the 23rd of January 2021. Can you say your name for the record, please?
Good morning, Celestine. My name is Estella Campbell.
Hi, Estella. What is your candidate number, please?
My candidate number is 217842430.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Yes, of course.
Okay. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you handle crisis situations?
I had an encounter with an elderly patient who was yelling loudly because the doctor had refused to increase her pain medication. I calmly listened, told her I was sorry about her discomfort, and asked if there was anything I could do to help. She started crying and told me that she was more upset about her family not calling to check on her. I encouraged her to reach out to them, which she did, and it turned out they were not even aware of her hospitalization.
Do you find that communication skills are important for a nurse?
Communication and interpersonal skills are of the utmost importance. Nurses must communicate effectively with senior medical personnel, patients, and the staff. But they must especially be good at communicating with the patient's bystander or family.
Talk about a time you worked in a fast-paced setting. How do you prioritize tasks while maintaining excellent patient care?
Working in an ICU setting is extremely fast-paced, and it is essential to prioritize your tasks for the day. At the beginning of the shift, I make a to-do list with everything that needs to be accomplished. I put the must-do things at the top of the list, and the things I would like to do at the bottom. Administering medications are placed at the top of the list, and washing a patient's hair is further down. While I would love to accomplish everything, it just isn't possible.
Tell me about a time you stepped into a leadership role.
I have acted as a charge nurse numerous times in my career. I have had to lead co-teams, respond to rapid responses, and make difficult staffing decisions. As a charge nurse, I have determined patient assignments to ensure that assignments are fair and equal. Furthermore, I have to ensure that the nurse's skill set is sufficient for the assignment.
Tell me about a time you were under a lot of pressure, and how did you get through it?
I was the most senior nurse in the unit for over a decade. I had to not only handle my patient assignment, but also was to act as a resource to the other newer nurses on the unit. I had to make sure my time management was great, as well as my ability to drop everything and help someone else. I had to stay organized, otherwise, I would not have been able to assist others.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Preparation time is over. You can now start the role play. Don't worry if I stop the role play when the time is up. All the best.
Hi there. I'm Estella Campbell. I'm the charge nurse in this community center. How may I help you today?
Nurse, my son was bitten by a snake 10 minutes ago. Kindly do something.
Don't be panic. We are here to help you. First, Let me see the wound, please.
It is at the right ankle, nurse.
Have you done any first aid?
No. Unfortunately, I didn't think about it. I rushed him to the hospital.
All right. No worries. Let me examine your son.
Sure, you may please.
In the initial assessment, his vital signs seem to be normal. As of now, there is no visual evidence for the snake bite, such as fang puncture marks, bleeding, or swelling of the bitten part. However, in crate bite, no local marks may be seen. It can be noted by the magnifying lens as a pinhead bleeding spot with a surrounding rash.
Oh. I see. But nurse, he is having pain in the ankle area.
Oh. Is it? Please make sure your son does not move from the position. It is to slow down the circulation of venom if any. Don't make the child panic, as it may increase the blood flow. Make sure he stays calm and relaxed.
Okay, nurse.
Kindly, don't give any kind of caffeinated drinks to your son until the doctor examines him.
All right.
Right now, I can clean the area with soap and warm water. And, about 2 to 4 inches above the bite, I will apply a constricting band to the wound. It will help to withhold the poison circulating into the bloodstream if the snake is poisonous. Kindly observe the area for any signs of swelling until you reach the hospital. And, if the swelling rises up the extremity, the band should be moved higher up and loosened.
Okay, nurse. I got it.
Don't worry. Around 70% of all snake bites are from non-venomous species.
Thank God. But, I am still a bit nervous regarding the bite.
Your anxiety and nervousness are quite reasonable. Well, if you don't mind, can I ask you a few questions to get some basic details of the accident, please?
Sure, you may please.
All right, before proceeding further, may I know your son's age and name for the record, please?
His name is Phil Taylor. He is 10 years old.
Okay. Can you please brief the accident, please?
We were out with the family in our garden. Suddenly, he went after a hare and got into a bush. Then it happened. When he rushed out of the bush, I found a brown snake, which was around a meter long.
Okay, is there anything else to be added to the accident?
No, but I have a question.
Sure, you may ask.
Are brown snakes venomous?
Do you have the photograph of the snake, or can you identify the snake?
It was a usual one we often see. I do not have its photograph. But, I can identify it.
All right. Let me call the doctor and share the information with the hospital emergency department. So that, as you reach the hospital, they will be ready to start the treatment.
Nurse, I am really scared.
It's very natural that you would be scared about your son's accident. We are here to help. Trust us, and provide maximum support to your child.
I'll provide maximum support to my son. I trust you, and my son's life is in your hands.
No harm will happen to your child. He will be perfectly all right.
Thank you.
After reaching the hospital, they will perform a blood test and provide some effective management, including antivenom therapy, to your son.
Okay, nurse.
Now, I can arrange an ambulance for your faster transportation.
Sure. You may please.
Thank you. Upon discharge from the hospital, you should keep an eye on your son for any signs and symptoms of a delayed hypersensitivity reaction to the antivenom, which can occur up to 3 weeks after administration. Symptoms include fever, joint pain, rash, or unusual bruising, or bleeding.
Sure, I will.
Don't worry, the hospital nurses will give further notes on it. Additionally, your son will need follow-up appointments at the hospital. Make sure you don't miss it.
I'll take care of it.
I wish your son a speedy recovery.
Thank you, nurse. So, that is the end of your speaking role play. Thank you.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.